South Korea is using new technology to try to track down people infected with the coronavirus in less than an hour as it attempts to clamp down on those breaking quarantine rules. The country has had one of the most successful strategies in the world for dealing with the virus, with fewer than 300 people having died. Our Seoul correspondent, Laura Bicker, has more details.
Each gasp for breath, each drop of blood painted an alarming picture.
Do you have any cough?
No.
No cough.
No
and cough. Headache.
Wang Yu from Wuhan, China, was South Korea's first coronavirus patient. Her scans revealed she'd been ill for days before showing symptoms. Doctors realised then that carriers could infect others without knowing they were sick.
그 시간대에 거기를 가셨죠? 예, 맞습니다, 선생님.
At the peak of the outbreak, hundreds of contact tracers were mobilised. Lessons South Korea learned from previous epidemics.
그럼 실제 거기 가셔서 몇 시간이나 머무르셨죠?
She's allowed to ask personal questions and record private details because of special laws brought in to combat infectious diseases. Tracers then hit the streets to seek out CCTV footage. They'll look at phone and bank records to get the most accurate information. The details are sent out as emergency messages across the country. This was my team and I in Daegu in February. But that's the kind of thing
Another one.
Oh, we got another one coming?
Yeah, here.
10일 하루만 체크한 거예요?
Tracking down Covid-19 carriers once took days. After gaining access to even more data, it now takes less than an hour.
Actually,
How are you feeling?
pretty tired actually. I come from the South Carolina.
Technology is used at the border too.
And you have no symptoms?
Luckily not.
Park Ju-yeon is taught how to download a quarantine app on her phone. She won't be allowed to switch her phone off or move from her quarantine address for 14 days.
위반하면 강제 추방이에요.
This foreigner is told he'll be deported if he doesn't comply. But Ju-yeon feels this is right.
I'm so grateful that I can be on this territory, honestly. Nothing I can describe better. I'm just so glad.
Few have complained about any intrusion on privacy. It's been seen as a price worth paying.
애들 이쪽으로 오세요.
Track and trace has kept this country out of lockdown.
설치 안 됐어요. 설치하셔야 돼요, 먼저.
Meanwhile, hugs from dad at the arrival gate are replaced by a hosing down with hand sanitizer, an act of love in itself in these extraordinary times. Laura Bicker, BBC News, Seoul.
Boris Johnson has hosted a global summit on vaccines at a time when inoculation programs around the world have been severely disrupted by the coronavirus pandemic. In Southeast Asia, it's estimated more than 34 million babies have missed routine vaccinations, while both Nepal and Cambodia are facing significant measles outbreaks. Across Africa, it's estimated almost 23 million babies haven't been immunised, with Ethiopia, for example, currently fighting measles, cholera and yellow fever outbreaks. Recent research suggests disruption to these kinds of services could result in as many as 6,000 children dying every single day. Our global health correspondent, Tulip Mazumdar, has that story.
New mums trying to do the best for their young babies in the midst of a pandemic. This clinic in Niger's capital, Niamey, is usually packed, but restrictions on movement, a shortage of healthcare workers and the fear of catching Covid-19 have kept many families away.
I was so scared to come here because of the virus, but health workers have told me it's very important to come for my baby and what to do to stay safe, like wearing this mask and washing my hands all the time.
Many countries were advised by health officials to suspend vaccination campaigns to avoid the spread of coronavirus. But now there's a stark warning about the longer-term impact of this disruption.
Measles is on the rise, diphtheria, cholera. So what is now threatened is all of those gains in the last 30 years, that we will wipe them away just because children are not getting immunizations.
So has some damage already been done here? Are we going to see children die because of this?
we will lose children. We know it. It's right here. It's at hand.
Medical staff around the world are working tirelessly to make sure as many children as possible are vaccinated. Here in Bangladesh, immunisation clinics are reopening under a new normal. These types of clinics will be crucial when it comes to rolling out any eventual vaccine for Covid-19. The University of Oxford is one of around 10 coronavirus vaccines already in human trials, but there's no guarantee any of these candidates will actually work. At today's summit, Oxford's pharmaceutical partner AstraZeneca announced it can make 2 billion doses of the product available as part of efforts to ensure poorer countries have equal access to any future vaccine.
We want to have vaccines quickly, we should be doing and producing them at risk, scaling up to large quantities, and then making sure that those are available for some critical subgroups.
Here in Colombia, health workers go door to door trying to protect children against viruses that can be prevented. Almost £7 billion was pledged to that fight today so that these life-saving campaigns can continue. Tulip, Mazumdar, BBC News.